Hello, I'm Arman Khodaei, a 24-year-old individual with high-function autism. For today's video, we're going to discuss early intervention and some of my thoughts on it. I'm not going to go too much into the whole early intervention thing, but this is what I want to say, is that I do very much strongly support early intervention in regards to children with autism. I believe that the earlier that someone is intervened with autism, that the more likely they are to overcome that the autism, and if it's done at a very early age, they might overcome a great deal of that at a very early age, so it's not very noticeable. And the statistics and everything does back that up. A majority of people who have early intervention that have autism do overcome a great deal of that due to early intervention. So that's what the statistics show. So yes, I'm very much for early intervention. This video actually came about because I was talking to one of the parents that attends my support group, and so that's why this video is being made. So right now I'm going to give you some signs to look for a child that might have the early signs of autism. So according to Autism Speaks, here are the early signs. No big smiles or other warm, joyful expressions by 6 months. No back and forth sharing of sounds, smiles, or other facial expressions by 9 months. So once they don't share sounds or smiles, whatever. No babbling by 12 months. No back and forth gestures such as pointing, showing, reaching, or waving by 12 months. No words by 16 months. No two-word meaningful phrases by 24 months. And any loss of speech or babbling or social skills at any age. So if there's any regression of any speech or social skills or whatever, then try to get a diagnosis immediately. So this right here, I will have a link for you up for here in case you didn't catch all of that. When it comes to getting early, well, let's say you notice a friend who has a child like that. My thoughts are, I know some parents, they feel it's rude, it's not their place to say something, but look at it this way. For the parents out there, who have a child with autism, if you knew even earlier that your child had autism and you knew that you could do something about it, wouldn't you want to know? So I mean, yeah, I can see, I don't want to be rude, blah blah blah, but by not telling a parent, you're gonna make things. It's gonna be harder for them later down the road. Sometimes we gotta swallow our pride, and be rude to help somebody out. So I know some people feel that it's controversial to do something like that or to even discuss that, but sometimes helping someone is not always, it doesn't always come easy. So now when it comes to getting a diagnosis, depending on the age of the child, we could go to the pediatrician and ask for the pediatrician to refer you to a specialist, a psychologist or something that deals with that. Now, if the pediatrician says, "Oh, I don't think the child has autism," do not listen to the pediatrician. A lot of doctors say stupid things because they don't know what they're talking about. Unless the pediatrician is an expert in the field of autism, do not listen to them. Because a lot of times, there are pediatricians, whatever, doctors, who say things and they don't know. Doctors do not know everything, all right? So it's that simple, and you got to do your own research. There's a lot of medical blah blah blahs, things that happen from doctors saying things, and being incorrect. They're human, they make mistakes. So insist on that they give you a reference to a professional psychologist. If they don't, you can go on Google, Bing, Ask.com, Yahoo, whatever your favorite search engine is. Type in autism, type in your zip code or your city, and there should be a list of local psychologists along with some websites like Autism South America, and all that sort of stuff will come up. But if you type in your zip code with the word autism, there should be a list of professionals that come up. They can go and take it to. Also, if your child's a little bit older and and is enrolled in school already, preschool, whatever, some schools offer will diagnose your child, and so you can try that as well. You can speak um, to the school psychologist or to the principal or whatever, and talk about trying to get your child diagnosed if you suspect something. Again, if the teachers whatever don't believe you, seek out professional help on your own. So my thoughts now on early intervention. Like I said, I believe it's very important. Now here's the thing. In some videos, I've discussed how I'm not the biggest proponent of ABA, and the reason why it's not the ABA itself, the treatment that I'm against, is more or less about how the majority of people who go about handling ABA treatment. A lot of them, I don't agree with the way that it's executed a lot of the times. However, if it's done at an early age, the child is far less likely to remember, and the impact is very good. There's a lot of statistic studies that show that it's indeed very good. So I do support ABA at an early age because I do believe it is very helpful, along with OT, occupational therapy, and other therapies as well. The younger the better, because when we're very young, we're like a sponge, and we can be molded one way or the other, and there's a lot of opportunities to snap out of stuff. I think it's like to say by the age of 5 or maybe even earlier, you're stuck usually. It's almost, it's very tough to change who you are. At a very early age, who we are for the rest of our life is pretty set, unless somehow by will of our own we decide to change ourselves. But a lot of times that doesn't happen. So the earlier the better for intervention, much better. So if you're a parent and you just got a diagnosis and you're wondering what to do, get treatment as soon as possible. If you know someone, a neighbor or whatever, and you suspect they have a child of autism or whatever, confront them about it. Yes, it could be embarrassing to confront them about it. Yes, it seems rude, but you're doing them a favor in the long run, so just look at it that way. Anyway, I thank you for watching this video, and I wish all of you a most awesome day of awesomeness, and thank you very much. Alright, bye.